Hi, everyone. Welcome to A Day in Miami MD Edition. I'm your host, Dr. Karan Chopra, board certified plastic surgeon, Johns Hopkins trained, and an expert in eyes, face, and neck lifts. I am so honored to have Dr. Jaime Flores here today. Dr. Flores is also a Johns Hopkins trained, board certified plastic surgeon, and he's a master of advanced forms of breast reconstruction. Dr. Flores has invented the LS gap and perfected breast reconstruction at its most advanced forms. He's also at the forefront of restoring nipple sensation after mastectomies in women suffering from breast cancer. Dr. Flores, I was so honored to have you on the show today. We share a special bond, being that we both trained at the Johns Hopkins Hospital. It was a privilege to train. It's been #1 for 20 years consecutively. And beyond that, it has a rich history of putting out some of the highest skilled, safest, and most ethical plastic surgeons. After that, you had experience working at Johns Hopkins, training more residents, and then you came to University of Miami. Take us through your history and kind of what brought you to where you are now as CEO and founder of Flores Plastic Surgery and Sky Surgery Center.
I want to thank you for having me. It's an honor to be your first guest.
Thanks.
To be honest with you, and it's a pleasure to have such a great person in Miami with the skill level and our background together. I think that makes us have a great bond. So yeah, my journey is interesting. I owe it all to Johns Hopkins, just like you do. Your base and training there, the volume of what you see surgically, the hard work you put in Monday through Sunday, because it's never just Monday through Friday.
Right.
It pays off in the end. And for me, bringing me to Miami, where no one knows you, and you have to build your practice from ground zero. I'm from Baltimore, working at Hopkins, and when I started my practice at Hopkins, I knew half the town of Baltimore, so it was easy to get referrals, right?
Yep.
Here, no one knows you. No one knows where you trained. No one knows anything about you. And so I knew I had to grind, and I did. I think one of the things that taught us at Hopkins is, you work hard, you never say no.
That's right.
And that was my mantra. Paul Manson, our chairman, really taught us that. So when I came here, I had a skill set, especially breast reconstruction, and I offered it to those patients. The referral patterns kept coming in. Some of the surgeons would ask me to work at night or weekends. I never said no. So over years, and I worked a lot of hours, more than 100 hours a week. You built your name, and your results becomes your reputation.
That's right.
So as I did that and the results got better, the hospital started gaining notice of, who is this surgeon's doing really well. He's nice. He works hard. He's kind to the staff, and it keeps building and building to the point now where, I have a set referral patterns, which was great. God bless. Great results, great patients. But I never lose my humbleness. I still grind. I still see patients at home if they have to. I see them to take their sutures out. I personally put my hands on them. I think that's something that was taught from Hopkins from the very beginning.
Oh, absolutely.
And
patient care.
Yeah, I try to pass it on to young surgeons coming through, and it's easier to pass it on to someone like you who has had that foundation already.
Yeah. Now, tell me about the Quad A facility that you've created, which I also operate at and bring my out-of-town patients and in-town patients. Can any surgeon just create a Quad A facility like you have in Miami?
It's very difficult. I think you have to have the foreground thought of how do you want that center to be. Number one and foremost was I want to operate in a place that's super safe. It gets inspected by someone other than myself. I don't want to pass my own inspection. So it gets inspected by the state. A place to where you want to take your family to be operated on. I think that's the epitome of what you want a center to be like. Then if you start breaking it down into surgical facilities, you want low infection rate, low complications, high turnaround. So it's a boutique place. It has all the aspects of a full ASC, or ambulatory surgery center. It gets inspected by the state. We have the highest quality of anesthesia, PACU, team, and staff. But more importantly, it's a boutique surgery center. So I pick and choose who can operate there, who gets credentialed. I oversee, what procedures they're doing. and make sure that it stays safe. But the best part of that center is once you start operating there, that day is yours. Just because it has someone else's name, that day is yours. You're treated like your house.
Well, I appreciate that. And just this week, I did a fat transfer case, and I've been noticing so many more patients coming in saying, rather than a breast implant, I'd like to have fat injections. Rather than filler, let's do fat. And even for hand rejuvenation. And I think that's kind of a wave that might be starting, and maybe it's already arrived. I love fat for these procedures because you can improve the donor site, make the waist smaller, put the fat in the face or the breast, and it has a stem cell effect, which fillers can't do. It can rejuvenate the skin. Tell me a little more about your experience. I know you have that on Instagram. You have the fat cam, which is really fun to watch, but tell me kind of how are you using it these days and what are patients wanting?
Well, I think it gets underutilized, clearly. We've been working with fat for decades, and it still gets underutilized. You imagine 40 plus years. I use it all over. It is the best unilateral autologous tissue that you can use if you use it the right way.
Mm-hmm.
If you're patient with it, it can last forever. Some of it always gets absorbed, but you want that high rate of retainment. I use it all over just like you do, in the face, a lot in the breast. More and more patients are choosing that over implants because of the implant illness, the encapsulations, the infections, the trouble with implants. So using autologous tissue with or without lifts in and around the breast is golden. But you can fix other areas. Like you said, rejuvenation of the hands, feet even, divots and dimples such as cellulite, can fix those. It's a permanent fix with low risk.
So now patients are coming in, and so you're seeing patients requesting implants out and switching over to fat. Are you able to do that in a single stage, or are they sometimes requesting additional volume later? Tell me kind of.
That's a great point, because the last 5 years, the explantation, taking out the implants, has been a big push, especially in Miami. In Miami, we get patients from all over the world. So we get patients from South America, Central America, and the States. And explantation has been a big topic of discussion. I like to do it all at the same stage. Reason being is you can see the internal structures when you open up the breast. You know that you can see the muscle there. You can tack it down. You can inject a little bit into the muscle safely. No chance of getting pneumothoraxes or, trauma into the lung spaces. And then you can really wrap the breast around that fat that you put in appropriately. When you do it secondarily, you're almost doing it blindly.
Right.
Not that it can't be done, but it's a blind injection. And so I prefer all at the same time. And knock on wood, the last 5-6 years, I can't say that about all my surgical procedures, every single patient who's had an explant, lift, and fat grafting are super happy.
Yeah, I can't agree more with you. Speaking of trends in plastic surgery, let's take a look at this article. Someone just recently sent me this U.S. Sun article stating that fans now think that the Kardashians, Khloe and Kim, are now seeking a BBL reversal. Let's take a look at this. What do you think is going on here with this new trend? I'm sure you've heard about it.
I've heard about it, and I've done a couple patients, to be honest with you. I know we both use Renuvion or J-Plasma, which is a heat and skin tightening device, but it has all the usages that I've seen. So reducing these BBLs that are pure fat, you have to make sure, one and foremost, they don't have any foreign material, those biopolymers, silicones, because those patients can have a higher risk of complications. But pure fat, now you can kind of reduce and mold. Think about a clay mold, and then you're just taking it away and creating the shape that you want. That's number one. And then people ask about, that loose skin. You take the J-Plasma or Renuvion with that heat using its device, and you can pass it along the skin. One, it takes out the cellulitic divots.
Right.
Two, it's going to tighten your skin. Three, it's going to smooth out the areas of the lipo so you don't have lumpiness. And then the third, probably biggest component, since it is heat, it's going to lay down new collagen, so it's a lot smoother. The one component of doing Renuvion on the butt is it does take some time to smooth out because you're sitting, you're walking, so it's a dynamic area.
Now, unlike the BBLs, after a BBL, we instruct patients not to sit on their buttock for 3 to 6 weeks. With the Renuvion in the buttock, are you asking them to stop sitting and laying on their back, or can they pretty much get back to work right away?
Back to work right away. I think one of the key components is also exercising and movement and getting that skin to tighten. So I tell them to work out as soon as they feel comfortable. Massages are key. Regardless of what you do, I think massages are 30-40% of the recovery in any type of surgery. And I get them getting massages. They have a special different type of garment than the BBLs, where you don't want them touched with the BBLs. This garment encompasses the whole tush. We want a nice compression. And I'll tell you, every person's happy with that reversal. It may be the new trend in Miami since everyone was getting big,
I
going
totally
bigger,
agree. I
right?
think this wave is coming, and you're at the forefront of it with the Renuvion and lipo.
And I'll tell you, it's not just for women. Let's be honest, I have a lot of male patients who are doing the same thing. It's a thing, getting more contour to your tush. So who knows?
Well, fellas, you know where to find Dr. Flores. What I've been noticing with the new wave in Ozempic, semaglutide, is concerns with Ozempic face and even Ozempic butt, whereby these drugs can cause some sagging in the buttock tissue. Personally, some patients who are overweight, I've had them get on the treatment safely under control with a provider to achieve weight loss. And then after that, they can get the surgery more safely, maintain the weight loss with diet and exercise. What have you been recommending for your Ozempic patients, and what have you seen? Are you concerned about facial fat loss?
Yeah, so first I always send them to their primary. I have a special primary who deals specifically with weight loss. And so that specific primary, she's phenomenal. She does a full lab workup.
Okay.
Because one thing is having a high hemoglobin A1C or high cholesterol, and you need to really manage it all, thyroid levels. She usually will put them on a combination of what they need, most likely Ozempic, metformin. I think it's great. The weight loss is great. What I've learned too is there's some new anesthesia guideline regulations that I had to learn the hard way when I had to cancel a patient, where they want them to be off that medicine for a certain period of time. So that's something new.
Well, because when you go under general anesthesia, we ask them not to eat after midnight. Now, if they have Ozempic or Mounjaro on board, their stomach's not emptying.
Correct.
So they may not actually
That's
be
exactly right.
So
these are nuances, right? We didn't learn this, 5 years ago. It wasn't around.
No.
So we have to adapt. But their change in their structures is very different from just weight loss via gastric bypass. So you said the Ozempic face, it's real. So you have to pick and choose where you're going to take fat from, if you're going to use it, where you're going to lipo and do things. But I think overall it's a good benefit. I think we're still learning what the long-term benefits or risks are going to be with Ozempic.
I think there's no question patients with diabetes, obesity, this is not only going to change their bodies, but it can prolong their life. And so for them, I'm super happy. But for patients who are using it for aesthetic reasons, who are already underweight or at a normal weight, I do feel like I'm concerned about fat loss in their face and their other parts of their body.
Right, because also it's going to age you. People who don't need it, don't take it. It's going to age you. It's going to make you look a lot older than you really are. And honestly, it becomes harder to do anything for them.
Well, because you've lost the donor site fat
Correct.
too. So it's October. I was at your office yesterday and I saw all the pink everywhere. October is Breast Cancer Reconstruction Awareness Month. And the recent statistics say that nearly 1 in 8 women will be affected by breast cancer in their lifetime. Their mothers, sisters, daughters, aunts, grandmothers. Tell me more about the fundraising efforts that your company is doing this October.
Well, I started a foundation about 8-10 years ago. It was called Pink Petals, and its sole purpose and mission was to raise funds for women who have had breast cancer and can't afford reconstruction. Wow. And that's really a sad state in this country with our healthcare. Just to give an example, if you're born with a cleft lip, the government will pay to correct your cleft lip in this country. But it's not the same for breast cancer and reconstruction. So it's unfortunate. So we had this Pink Petals Foundation raising money, partnered with Baptist facilities, and we were able to do several patients a year. The foundation itself doesn't exist, but the mission and goal still does within me. So I still see patients. They don't have to have insurance. And if I can do their surgery and it can be accomplished and I can partner with Baptist, I still donate my time and free services to complete them. Because it's not fair that somebody can get a reconstruction and someone can't. We should all be entitled,
absolutely.
And there's something to say about that, it's more than just money and reimbursements, right? The joy and love that comes from doing that and successfully. I mean, that's reward enough. So it still goes on. It's just unofficial, and
Okay.
we don't do anything special with the IRS. It's just it's done out of the goodness of my heart, and we try to incorporate other surgeons involved.
Sure.
So it's a great camaraderie among surgeons who are donating their time.
So where can viewers go to donate to the fund? Can you show us the?
So they can go to the office directly. We're always we have different fundraisers throughout the year. Obviously, during the breast cancer month, we have specific programs that are going on. Perfect. They can call the office. They can go to Flores Plastic Surgery on Instagram. They can go to our website and leave a comment. And we really do try to help as much as we can.
Awesome. Well, Dr. Flores, it was a pleasure speaking with you today. I can't wait to see you again back at work tomorrow. And thank you so much for your time. I really appreciate it.
Thank you so much.
Great.